Hi, welcome to the new video. May 25 is observed as World Thyroid Day. It is to raise the awareness about the crucial gland named thyroid gland, which is an endocrine gland, that's the ductless gland, and to know about the different thyroid disorders, to be aware of the different thyroid disorders, to know about thyroid cancer, to be aware of the thyroid cancer, to know about the treatment, to know about the causes, to be aware of the thyroid disorders is what we are observing the World Thyroid Day. What is this thyroid gland? Thyroid gland is a small endocrine gland, a butterfly-shaped gland present in front of the neck, beneath the skin, below the Adam's apple, connected with two lobes, also connected by a band of tissue known as isthmus. Anatomically, it is the first endocrine gland to be formed, that is within 3 to 4 weeks it is formed. 3 to 4 weeks is the time the first endocrine gland formed in the body is thyroid gland. And it is endodermal derivative. We have ectodermal, endodermal, all those things, mesodermal. This is endodermal derivative, specifically saying from the floor of the primitive pharynx. Endodermal derivative formed in the 3 to 4 weeks of the life. The first endocrine gland formed in the body is the thyroid gland. What are the cells present in the thyroid gland? It can be divided into two cells: follicular cells, parafollicular cells. The follicular cells, the derivatives are mainly the T3 and T4. Triiodothyronine and thyroxine. T3 and T4 are the two derivatives you can say on the follicular cells, which are the derivatives of tyrosine derivatives. Mainly saying tyrosine derivatives it is. Okay. Follicular cells, parafollicular cells. Follicular cells are mainly T3 and T4. Parafollicular cells, adjacent to the follicular cells, is known as parafollicular cells. The main hormone is calcitonin. Calcitonin is regarded, or it is concerned with the regulation of the blood calcium level, the calcium metabolism. We'll come to the follicular cells mainly. Follicular cells, I told you, T3 and T4. It can be again, it's a tyrosine derivatives. It can be, the main form is tyrosine derivatives, which is an amino acid derivative. Also, it can be from the iodine, like in the dietary source, iodine. But we need a form of iodide. The dietary source is actually iodide, the reduced form of iodine. Okay, so one is tyrosine derivative, the other one is iodine, dietary form iodide. So tyrosine derivatives, actually it is coming from a larger molecule known as thyroglobulin, represented as Tg. Thyroglobulin is the one which derives tyrosine derivatives, that is the T3 and T4. The other one is dietary source, mainly iodide, the reduced form of iodine. These are the things coming from follicular cells. So we are concerned more about the follicular cells. Coming to the synthesis of thyroid gland. So the synthesis of thyroid gland, we need the hormones to be synthesized. We have T3, T4, TSH. When you talk about generally we have T3, T4 and TSH. When you see the report, when you see a TFT, thyroid function test, we have these three values. The synthesis starts from, actually a blood vessel is there. Near to the blood vessel we have a follicular cell. Always near the blood vessel we have a follicular cell. So in the follicular cell we have a basolateral end and an apical end. The basolateral end is adjacent to the blood vessel. The apical end is far away from the blood vessel. So the first one, consider as a follicular cell. We have basolateral end as well as apical end. In the blood vessel, okay, which is adjacent, in the blood vessel we have iodine and sodium. Iodine and sodium. Suppose iodine and sodium is there in the blood vessel. This has to go to the follicular cell. So the iodine and sodium transports from the blood vessel to the follicular cells by a synporter known as sodium iodide synporter. NIS, sodium iodide synporter, which is a secondary active transport. Yes, an example for secondary active transport. Sodium iodide transporter or synporter does, what does it do? This iodide and sodium present in the blood vessel moves into the follicular cell by a synporter known as sodium iodide synporter. So the iodide and sodium is reaching the follicular cell now. Now you should know something about sodium iodide synporter here. This sodium iodide synporter is present in the thyroid gland. It's present in the parotid gland. It's also present in some other examples also. So thyroid gland is, what does it do? It means it is the capability of iodide uptake. It's an uptake of iodide. It is capable of uptaking the iodide. That is a function of the sodium iodide synporter, which is a secondary active transport. So this sodium and iodide is transported to the follicular cell now. Now we have iodide there. What happens to the iodide here? Immediately it shifts to outside. From the blood vessel it has come now to the follicular cell. From the follicular cell immediately, soon after it reaches here, it goes out of the follicular cell. Means to the apical end it goes out the follicular cell. So in replace of going out the iodide cell, we need some iodide ion. I mean, we have iodide ion going, is a negative charged. we need some negative charge to be balanced. So the iodide ion goes out of the follicular cell. We need some negative ion to come into the follicular cell. So what ion comes here is chloride ion. So when the iodide ion coming from the blood vessel via the sodium iodide importer, immediately the iodide goes out of the follicular cell. In replace to that, chloride ion comes inside the cell through an exchanger known as chloride iodide antiporter. There is an exchange taking place between iodide and chloride. So why it is happening? Why the iodide is going immediately out of the follicular cell? Because it is in the cell membrane bound enzyme. It is in cell membrane bound form. So this iodide going out is in a reduced form. It has to be oxidized. That's why the iodide is immediately going out. It's a cell membrane bound form, as well as it's a reduced form. This has to be oxidized form. For our hormone synthesis to happen, it has to be in oxidized form. So the iodide has to go out of the cell. In replace to that, chloride ions comes inside the cell via a transporter known as chloride iodide exchanger or chloride iodide antiporter. So now iodide is outside. Now it has to be oxidized. Okay, the oxidized form of iodide takes place by the help of an enzyme known as TPO, thyroid peroxidase. So thyroid peroxidase is the enzyme which helps the reduced form of iodide to be oxidized form of iodide. That is the role of TPO, thyroid peroxidase. TPO, thyroid peroxidase, helps the reduced iodide form to convert into oxidized form of iodide. Okay. Now this iodide has to be converted to tyrosine. Now that is known as organification of iodide. The iodide, the reduced iodide form, oxidized form, it is converted to oxidized form. Now this oxidized iodide has to be converted, or it has to be incorporated into tyrosine. This incorporation of iodide into tyrosine is known as organification of iodine. So organification of iodine is nothing but the incorporation of the iodide, which is oxidized form, into tyrosine. Now we have a organification of iodide taking place. Now after organification, what happens? There is something known as coupling reactions. There are certain reactions occurring, that is coupling reactions. So we have now monoiodotyrosine, one iodotyrosine, we have MIT now, which is known as MIT, monoiodotyrosine. Now one molecule of monoiodotyrosine combines with another molecule of monoiodotyrosine, forming diiodotyrosine, DIT. Diiodotyrosine, DIT, combines with one more molecule of MIT, DIT plus MIT. Now it forms T3, which is our important hormone, T3. DIT combines with MIT, forming T3. Now DIT combines with another molecule of DIT, it forms T4. If the MIT goes and binds to DIT, it's an ulta process, reverse process, it's known as reverse T3. Okay, so that is what we have. MIT plus MIT is DIT. Okay, DIT plus MIT we get T3, DIT plus DIT we get T4. MIT plus DIT means reverse T3. Okay, so reversely. Okay, so these many things are there. Now we have, as I told you, sodium iodide importer is there. If there are more excess levels of iodide transporting in this importer, usually normal levels of iodide transported, and it has to happen for the synthesis of iodine to take place. So if more excess levels of iodine are transported through the sodium iodide importer, what happens? There is a condition known as Wolff-Chaikoff effect. Wolff-Chaikoff effect, WOLF, Wolff-Chaikoff, CHAIKOFF effect. Wolff-Chaikoff effect is nothing but the excess levels of iodide transporting into the follicular cell via the sodium iodide importer. This condition known as Wolff-Chaikoff effect. That can happen. Okay. Now we have the hormone. We got MIT, DIT, T3, T4. T3 and T4 is come now. Now what happens? This form. These forms are the hormone synthesized is stored in the form of a structure known as colloid. These hormones, what synthesized, is transported into the follicular cell in the form of colloid. It's stored in the form of colloid. Okay, so the colloid is a storage form. It can be stored or it can be reserved, act as a reservoir for 2 to 3 months. So the hormone synthesized is transported into the follicular cell in the form of colloid. It is stored. It can be stored for 2 to 3 months. And if you break this T3, T4, if you break the colloid, if you want to release the T3, T4, you can break the colloid so that T3 and T4 can be released into the blood vessel. So the hormone synthesized is transported into the follicular cell. It is stored as in the form of colloid, which can be stored for 2 to 3 months. If you want the release of T3 and T4, you have to break this colloid. Okay, so the release of T3 and T4 happens once the colloid is broken, and it goes to the blood vessel directly. So there is no duct happening here. There is a ductless gland. It's an endocrine gland because the hormones directly go to the blood vessel without any duct. Okay, that is the synthesis of thyroid gland. So I hope you understood the synthesis of thyroid gland. Coming to the actions of thyroid gland, mainly I will talk about T3. T3 is the very important thing what we know should know about more actions. So first action you can take it increases the basal metabolic rate. T3 increases the basal metabolic rate. It increases the resting metabolism. It increases the oxygen consumption, thereby increasing the basal metabolic rate. That is the first action of T3, specifically saying T3. The second action of T3. Have you heard of ETC? Electron transport chain. What happens in ETC? There is an increase in the body heat. The T3 increases the body heat. This is known as thermogenic action. What happens in hypothyroidism and hyperthyroidism? Hypothyroidism, we know there is a decrease in the T3, T4 levels. When there is a decrease in the T3 level, what happens? T3 is supposed to increase the body heat. So there is a decrease in the T3 level. What happens to the person? The person cannot tolerate cold. It is cold intolerant. What happens in hyperthyroidism? There is increased T3. So there is a heat intolerant. They cannot tolerate heat. So hypothyroidism is considered to be cold intolerant, whereas hyperthyroidism is considered to be heat intolerant. Now third action, metabolism, the main part, metabolism. We talked about basal metabolic rate, we talked about ETC. Now coming to metabolism one by one, carbohydrate metabolism. T3 increases the blood glucose level. It promotes glycogenolysis, it breaks down the glycogen. It promotes gluconeogenesis, it increases the blood glucose level. In lipolysis, it results in lipids, it promotes lipolysis. It increases free fatty acid synthesis. It promotes lipolysis. In proteins, it promotes proteolysis. So it has gluconeogenesis, glycogenolysis, lipolysis and proteolysis. What about the cholesterol levels? It decreases the blood cholesterol levels. So in hypothyroidism, there is an increase in blood cholesterol level. So dyslipidemia can be seen in hypothyroidism. Okay. It also can be, if hypothyroidism, by increasing the blood cholesterol level, what happens in hypothyroidism? It is more prone for atherosclerosis, the heart diseases. So hypothyroidism can be connected with heart diseases, atherosclerosis, or it can lead to even heart attack also. So hypothyroidism, why? It is more prone for the atherosclerosis, why? It increases the cholesterol levels. Now coming to the fourth function, third is metabolism, fourth is development. Development mainly, actually thyroid is an all-rounder. It affects all the organs. It is there in everywhere, every system, everywhere it is there. So development wise, we have brain growth as well as bone growth. The thyroid, the T3 plays an important role in brain growth as well as bone growth. So in brain growth, it increases the myelination in the CNS. It increases the myelination in the central nervous system. That is the brain growth. What happens in congenital hypothyroidism? The bone growth and the brain growth are affected, and the congenital hypothyroidism, we can see mental retardation as the main thing. Mental retardation and stunted growth are the main symptoms in congenital hypothyroidism. So it can affect both the brain growth as well as the bone growth. So development, brain growth and bone growth are the function of T3. It increases the responsiveness of the heart to the circulatory catecholamines, means especially norepinephrine. What happens? It increases the responsiveness of the heart to the circulating catecholamines, mainly norepinephrine. And this norepinephrine is a beta-mediated action. It's action by the beta-mediator. What does it do? It increases the heart rate, increases the stroke volume, increases the myocardial contractility. So this is beta-mediated action. So thyroid directly doesn't do anything. Thyroid, what happens? It increases the responsiveness of the heart to catecholamines, mainly the norepinephrine. Norepinephrine thus increases the heart rate, increases the stroke volume, increases the myocardial contractility. Okay, and it is beta-mediated action. Thyroid storm can be managed by the beta blockers. Because of this particular thing, it is beta-mediated action. So thyroid storm can be managed by giving propranolol, a beta blocker. What are the investigations done? When you see the blood report, you can see T3, T4, TSH. So thyroid function test is the function test. Thyroid function test is the one which we do as an investigation. Usually we are doing nowadays in the fasting state. T3, T4, TSH. If T3 and T4 comes down, TSH is high, it means it is hypothyroidism. If TSH is low and T3, T4 is high, it is hyperthyroidism. And there are other conditions, subclinical hypothyroidism, all those things that depends on the history and the examination. Now coming to the management, hyperthyroidism and hypothyroidism. Hyperthyroidism means anti-thyroid drugs. We have to inhibit or block the thyroid peroxidase. We have to inhibit the sodium iodide importer. Because if we have to block or we have to inhibit the hormone synthesis, we have to make it coming down. So hyperthyroidism is mainly these type of drugs. Hypothyroidism, we can give T4 salts or T3 salts. T4 salts is levothyroxine, L-thyroxine what we give. Whereas T3 salts, it is triionothyronine. Okay, liothyronine. T3 is the liothyronine. Okay, levothyroxine and liothyronine can be the hypothyroidism treatment. So that is what T3 and T4 salts. Okay, also iodine intake. iodine rich in diet, all those things can be iodine diet has to be included. This can be the treatment of hypothyroidism. But hyperthyroidism, there can be Graves' disease, it can go to some other thyrotoxicosis. Okay, it can have different manifestations in ophthalmology, in any, I told it's a all-rounder, thyroid is a all-rounder. So what are the hyperthyroidism treatment? Anti-thyroid drugs. It can be thiamide drugs. Mainly we have 3 thiamide drugs: propylthiouracil, methimazole, carbimazole. Okay, propylthiouracil is safe in lactation. Lactating mothers, it is safe. Carbimazole is the prodrug of methimazole. Methimazole is the first choice of drug which I told you about Graves' disease. Methimazole is the first choice of drug in Graves' disease. Carbimazole is a prodrug of methimazole. So these 3, propylthiouracil, methimazole, carbimazole, are the 3 thiamide drugs used in hyperthyroidism. Then we have iodides: potassium iodide, Lugol's iodine. These are the iodides. One more thing we have is deiodinase inhibitors. This deiodinase inhibitors, which contains mainly beta blockers, steroids. Even the propylthiouracil also is a deiodinase inhibitor. So these are, and even one more drug is amiodarone. These many things are coming under the deiodinase inhibitors. So these are the treatment of hyperthyroidism. So today, as World Thyroid Day, you should be aware of the diseases, disorders of thyroid. You should be aware of the thyroid cancer. Most commonly, thyroid cancer is a common cancer, medullary cancer, the papillary cancer, carcinoma of thyroid, medullary cancer, carcinoma of thyroid, squamous cell carcinoma. So medullary carcinoma is what we come across. So there are surgical treatment options. Finding out we can take a biopsy, seeing a swelling in the neck. If you see any swelling anywhere, if it's consistently you are seeing, take a biopsy. Take a biopsy and test it. Rule out the cancer. Okay, thyroid cancer is becoming common nowadays. If you find it earlier, you can have a chemotherapy, you can give, and surgical resection can be done. These things can be done. Okay, surgical removal, surgical field is a lot. Thyroid cases are a lot nowadays. Okay, thyroid gland is a common thing. What even ENT surgery, it come across every department. I said medicine, surgery, ENT. So be aware of the thyroid gland diseases. If you have any swelling in the neck, go have a scanning, consult the doctor, take a biopsy. Okay, not directly going and taking biopsy for each and everything. Consistently bring the levels continuous in a proper way. T3, T4, TSH should be in a controlled way. So it can affect the other organs also. Okay, especially in females is more common. It has to be related to reproductive also. So it can affect the menstrual cycles. Okay, these many things are there. That's why I am here to make you aware of something about thyroid gland. So this is World Thyroid Day. Thank you.